she says. Thank you so much for your patience. We are beautifully, fashionably late, but I think that is okay at the start of the year. For whom is this the first event that they are attending at the beginning of this year? Oh my goodness, okay, good. So it's going to be a good one. All right, if you can kindly take your seats. European Commission Executive Vice President Teresa Ribera, we have S&D President and Vice President, esteemed speakers, esteemed audience, those of you who are here on site at the European Parliament in Brussels, and of course, those of you, I hope I'm looking at the right camera, who are joining us online. Thank you very, very much for being with us. Can I ask all of you who are here in this room to please make sure that your phones are on silent? Number one. The second is a reminder that we have interpretation. English on channel 2, Spanish on 8, French on 3, German on 1. So do take a moment to make sure that you are well set up, and a reminder to those of you online that you also have the same channel. You also have interpretation for the event in the same languages. All right, so good afternoon. Very warm welcome to the European Parliament, to this S&D Group event, Healthcare Across All Policies. My name is Katrina Sickle. I have the privilege, really the privilege, of navigating us through the next 2.5 hours, which will be brought to life beautifully by a very diverse, broad speaker lineup. We are very lucky to have a lot of passionate experts in the House to stimulate your grey matter. But what that means is that I am asking you to be in listening mode. That means I'm asking everybody to keep, please, your questions or your comments until the non-alcoholic networking cocktail, which comes at the end of the event, okay, at 16:45 to 8 o'clock. So I really do thank you for your understanding on that. As you all know, if you've done your homework, and I guess you have because you wouldn't be here today, we'll build on the approach set out in the S&D position paper, Health as a Priority Across All Policies. So there are primarily two focus areas here: how EU policy making can best tackle the root causes of illness, but also the way forward for guaranteeing equal access to healthcare in the EU. And a reminder is that the collective starting point, the strong starting point, is that public health is one of the foundations of social justice, democratic stability, and citizens' well-being. And you're going to hear that again and again. So we have opening words from 4 speakers. One is a video message. We have 2 panels. The panels follow directly one to the other, so there's a lot of listening. Please keep your energy right until the end, because I want to make sure that the very last speakers really do have your attention, but it's my job to keep us all to time. So the speakers have kindly agreed to be beautifully concise. In the spirit of concision, let me please give the floor to the S&D Vice President for Green Deal, for a healthy planet, healthy people, and sustainable food ecosystem, Christophe Clergeau. Welcome, thank you.
Thanks, Kat. It's a pleasure to see this room full of people coming from all types of factors in Brussels and in Europe, and very important local elected people, to present what we want to push as S&D Group in link with health policies. Because yes, we decided that health should be one of the political priorities of our group and a priority through all European policies. It has been done collectively under the guidance of Iratxe, Pérez, García, with the benefit of the energy and commitment of Vitenis and the UKITs and other coordinators and MEPs. And it's not only a commitment of our group, but also of our political family, because we have the pleasure to have Katia Tuto here, President of the Committee of the Regions, and obviously to have with us Teresa Ribera to hear from her keynote on her vision. When we are dealing with health, we are dealing with fundamental rights of people. We are dealing with living conditions. We are dealing with social inequalities, including women's health inequalities. We are dealing with greening, with environment, with the future of our planet. And it is really in that perspective that we worked and that we want to act, because today it's not the final point of a process is the starting point of a political battle, a political fight to promote really health as a priority through all policies. We promote 2 pillars: prevention, where and how you live, where and how you work, pollutions and dangerous products you are exposed to matters and have impact on your health and brings to a lot of new not communicable diseases. Exposome, what we call exposome, all these exposures explain perhaps 80% of the disease, and genetics only 20%. And to put prevention at the core of health policy in link with this exposome approach is totally a political revolution. And the second pillar is about equality, access to medicine, access to healthcare system, inclusive health preparedness, because we want to protect people all over Europe. So yes, we are fighting for people, we are pushing for ambitious European Commission agenda and for ambitious budget, ambitious MFF. We will do that in close link with you, with research actors, with civil society, with local and regional authorities, and we want really to win this battle, to organize this fight all together and to change day-to-day life of people in Europe. Thank you.
Thank you so very much. Thank you for starting with the passion, I think, the passion and the ambition, you use that word, that we will witness throughout the event, and also that real call that this is forward-looking. So we're going to look at the state of play in all sorts of different areas, but also what do we want to see? What do we want to happen? Where are the priorities? What needs to be done? Again, very much building on the position paper, but on your priorities and, as you use the word, fight, battle in general. So let me pass directly to the S&D President, to Iratxe Pérez García. Welcome and thank you. The floor is yours.
Thank you. García Pérez. I'm thinking in my father. No problem. And here in Europe sometimes change the order, but it's García Pérez.
I see that.
In any case, you have to know that García and Pérez are the more usual surnames in Spain, both. García and Pérez, but the order is García Pérez. Dear colleagues, dear friends, it is a real pleasure to open this important event today. I want to thank Christophe for his leadership, thank Vitenis and all our team for the strong work behind this position paper. And I warmly welcome Commissioner Rivera. Thank you for to be here with us, because it's other political message, and we know that we can count with your commitment in our work and in our political priorities. And your presence, of course, sends a clear message. Health matters in Europe. Health is one of the top priorities of the S&D Group. We have fought for a strong European health policy for many years. Sadly, it took a pandemic to make everyone see the deep weakness of our health systems and the vital need for preparedness and resilience. COVID-19 opened eyes, but it did not yet open enough doors to action. Today, Europe faces a serious health workforce crisis. Medical deserts still exist. Places where people struggle to see a doctor when they need one. Access to care is not equal. Yes, we are closer to a European health union, but we are not there yet. And the road ahead is still long. That is why we are deeply concerned to see the EU for Health programme disappearing in the next multi-annual financial framework. Health risks being spread thin, diluted across many funds, losing focus and strength. As the memory of COVID fades, we must ask a simple but urgent question. Will health still be a threat as an emergency in the next EU budget? For us, health is not only about pandemics. Health is a universal right, not a privilege. It is at the heart of a social justice, democracy, and economic strength. Closing the gender health gap is especially close to my heart. Ignoring women's health means denying fundamental rights. In some member states, it puts women's lives in danger. This is unacceptable in our union. Mental health is another emergency. Poverty, inequality, violence, war, climate, anxiety, and digital pressure all take a heavy toll, especially of young people. Europe must finally recognize mental health as a major health priority, backed by a real and comprehensive European mental health plan. And this plan must not stay on paper. It must come with a real action, real funding, and real laws that are applied in all member states. And as Christophe rightly said, health is everywhere, in the air we breathe, the water we drink, the food we eat. We cannot only treat symptoms, while the causes keep pushing our lives. Health must be part of every policy, of every law. Our position paper is a roadmap for this mandate. We welcome progress on the pharma package, critical medicines, and global health resilience. But we are disappointed by the lack of ambition from health in 2026. Europe must do more on mental health, on prevention, and on tobacco control. We are ready to fight for it, because a healthy Europe is a fair, a stronger, and more hopeful Europe. And that is the Europe we believe in. Thank you so much.
Thank you very much, MEP García Pérez. Voilà. Thank you. So, and also for covering so many of the areas which we will bring to life today through the speakers: women's health, mental health, tobacco control, resilience, preparedness, and so much more. But first, if I might turn to the Commission Executive Vice President for a clean, just and competitive transition. Very, very warm welcome to you, Teresa Ribera. The floor is yours.
Thank you. Thank you so much. It's a great privilege to be here with you today. Allow me to start with expressing my best wishes for 2026, even if it is only 14th of January, and we have the impression that it's been far away since we started the year, but it is important. And I like thinking that starting the year thinking on how we can promote health for all. What is the role of the European institutions dealing with health for the Europeans is quite an important and positive aspect to start the year. We are used to think that we are the best place in the world to live in, and I'm pretty convinced that this is the case. We know that our treaties underscore the fact that we aim to build high quality of life for Europeans, and we are proud when thinking that basic services such as education, health systems, health assistance, capacity to be covered when we don't have a job or when we are retired are key aspects to ensure that people can concentrate on how to keep on building on opportunities instead of fighting for survival. But this is always an ongoing fight, an ongoing case to be built. So I would like to congratulate you for this position paper. Christophe, Iratxe, all the colleagues that have been deeply involved in this work deserve our gratitude, because it reminds us that health is a fundamental right, not a privilege, and that we need to think in terms of research, assistance, prevention, recovery, planning, resources, education and training skills, industry, so much and so much. And I completely agree and support this vision. This is what we are trying to do. And we are working also hard in the Commission. I'm sure that there are things where there's still room for improvement, and I have taken note of your comments that will help us to keep on improving. But allow me to start with something that I know you're aware of. In December, we proposed a wide health package. We thought about a biotech act, a cardiovascular plan, proposals to simplify the administrative procedures leading to medical devices, facilitation of support in different situations being faced by our citizens or our member states. Challenges linked to cardiovascular diseases, something that impacts our society and our economy. We are talking about Europe's #1 killer. More than 30% of deaths per year in Europe are directly linked to cardiovascular diseases. And this plan is a good start in a step up to ensure that EU actions may improve the figures, and being vocal about that, being sure that we can connect the different dots will be important. It has always been the case. It is more important than ever. The plan covers the whole cycle of cardiovascular health and places a strong emphasis on prevention and screening. This is a key factor to tackle most important determinants of health and deals with a wide range of lifestyle and hereditary risk factors. The plan also boosts competitiveness through investments in research and innovation, including digitalization. Beyond the plan, competitiveness is to be implemented across the whole health agenda. We need to think on how we can ensure that these industries do want to invest in Europe, do want to provide solutions in Europe. Innovation is a key pillar of a strong health system. Those who invest and innovate in Europe need to identify that it is a good place to invest. When we look at breakthroughs in cures and treatments, may come from some very small, highly specialized companies. They take the risk, they push science forward, and sometimes they struggle to grow here in Europe. But we appreciate this commitment. We need to find ways to ensure that it is still the case and we can keep on doing here. We hear this again and again, how we can ensure that there is support for research and innovation, how the administrative burdens can be proportionate to the risk that they may be facing, how we can work across borders, how we can ensure that our predictability and stability when thinking about rules are fair, fit for purpose, and are appreciated and understood by the different players. How we can ensure that progress takes place at the right path. Keeping innovation in Europe means providing funding. When the market is not going to deliver, and it is particularly the case when we think about rare disease, we need to be sure that member states, that European budget is there. This is why, from the competition perspective, we work on our stated rules, giving clear guidance on how governments can back these initiatives, how important projects of common European interest can help in this field, allowing member states to pool resources together and to support cross-border projects that tackle market failures and drive innovation. We have just approved 2 such projects in health, one for projects across the pharmaceutical chain and another one for the next generation of medical devices and advanced digital and AI tools that can support predictive, preventive, and personalized care. We try to combine a strong public support, clear rules, a shared commitment to improvement people's lives, and of course, the public interest behind the social outcome that all of this can bring. Still thinking around my own portfolio as Competition Policy Commissioner, I would like to add a couple of things to support in innovation, because competition policy also acts as a force in protecting patients and public health. Still, allow us to remind ourselves to what extent it is important, public services and the defense of citizens' health. We act when companies restrict innovation, when they block generics, when they sometimes try to keep price artificially high. We have taken strong action against practices hindering competition in pharma and health sectors, showing that even short delays in generic entry carry huge costs for societies. Tackling excessive pricing and saving health systems could allow us to keep vital cancer medicines available. Recognizing that affordability in pharmaceuticals is not only about consumer welfare, but also about public health is key. We have carried out inspections in the vaccine sectors. We know that this is something that needs to be happening one day after the other. Paying attention to well-functioning markets, paying attention to the role of competition tools to facilitate public interest goals. This is why we intervene when behavior distorts the balance. This is how we contribute on a functioning, competitive European market also in the health sector. As you rightly point out in the position paper, health must be transversal. It is a cross-cutting issue. It is environment, it is competition, it is public services, it is public procurement, it is industry and growth. Human health is closely linked to the health of animals and the health of our environment. Zoonotic diseases, air and water pollution, loss of biodiversity, all directly affect our lives. Let's be aware of that, because the data is pretty alarming. 1/3 of all heat-related deaths worldwide already occur in Europe. Between 2022 and 2023 alone, more than 100,000 people in a region died due to heat waves. Think about those saying that this is nonsense, that this is woke. Think about forgetting about building resilience, about developing the capacities to prevent, react, and strengthen the readiness. 4 of the hottest years on record have occurred since 2020, and 1 in 10 urban residents now lives in flood-prone areas as extreme rainfall and sea level rise start to occur in a much more frequent pattern. Globally, nearly half of humanity, about 3.6 billion people, live in areas highly vulnerable to climate change. In Europe, where 80% of the population will live in cities by 2030, urban areas are on the front line of this crisis, concentrating both risk and solutions. So it is so good to count on the commitment of mayors, of regional authorities, people that understand that also when they frame, shape, and enforce their policies, take care of those risks and try to address them in the best possible way. Climate worsens many of the public health challenges. It affects respiratory and cardiovascular diseases, affects the spread of infectious diseases, threatens food security, and increases mental health risk, being mentioned by Iratxe in her comments. The most vulnerable suffer the most. Think about elder, children, pregnant women, people that cannot afford proper isolation in their homes. Think about the air they breathe, as you said. So yes, it is a question of justice. It is a question of equity. It is the question or a question related to the values that we say that we want to fight for. Cutting emissions, improving air quality, ensuring clean energy, all these things do help. Protecting health, therefore, means protecting nature, ensuring sustainable food systems, addressing climate change with urgency and ambition, as the World Health Organization stated, one planet, one health. It is a question of fairness. It is a social issue. Of course, it is a field where there are business, industrial, economic opportunities, but it is also fairness and social justice. We can promote prevention, reduce disparities, build more resilient and inclusive societies. And that's what it is reflected in your report. That is the intention that you pursue. That is how we find ourselves properly defined as Europeans, as part of our soul, as part of our model. So thanks a lot for your work, and count on the Commission to keep on thriving. Thanks a lot.
Thank you very much. So much good stuff in there. I will pull out, just for me, to underline what you said there towards the latter part of your contribution. Health is highly, highly transversal. I think a lot of people for whom this is not their daily bread would not be thinking about this, and also the importance how inextricably linked it is to the health of the environment, to nature, to animals, whether it's One Health, whether it's the exposome approach, which we will hear a little bit about later. So thank you again for bringing to the fore a lot of the issues that we will speak of today. Normally, as a moderator, I'd have a bazillion questions for these good people, but time is of the essence. So it just remains for me to thank you so very, very much, and to enable you to take your seats and to ask you one more time, please, could you give... Oh, no, you don't go, because we've got an intervention by video. You want to stay with me, don't you, for that? Yeah, I was about to tell you to just go away and, you know, just look at it over there. Hold that thought a moment. Just to say one thing, because you did, I think, the words positive and hopeful were used by both of you in the context of health. We've got some students in the room, haven't we? People under 105 years old. Where are the students in the room? All right, so I think not least of all you will be delighted to hear those words used, and I hope that you will come away from this event, as I said, so that we will also flesh out what is the future, where can we make progress, what is best practice, what's going on that's good. So a very warm welcome to you as well. And that takes me into our last of the 4 opening speakers who joins us via video. It is the Minister of Health of the Republic of Cyprus, Neophytos Charalambidis, and he joins us for a couple of minutes for a video intervention. If we can launch, wonderful.
Your Excellencies, health is not everything, but without health, everything is nothing, as the German philosopher Arthur Schopenhauer wisely observed. Today, this insight is more relevant than ever. The COVID-19 pandemic exposed significant vulnerabilities in health systems worldwide and demonstrated how deeply health is intertwined with economic stability, social cohesion, and security. It reminded us that health is not merely a sectoral concern, but a cornerstone of sustainable development across all areas of society. This relationship also works in reverse. Just as health underpins all sectors, decisions taken in those sectors profoundly shape health outcomes. Health is not created solely in hospitals or clinics. It is shaped every day by policies and actions across all areas of government and society. The Health Across All Policies approach recognizes this reality and calls for health considerations to be systematically integrated into policy making across all aspects of governance. Health Across All Policies is not about placing responsibility solely on ministries of health. It is about shared responsibility, strong intersectoral cooperation, and evidence-based decision-making. At its core lies equity, ensuring that no one is left behind and that policies reduce health disparities. Cyprus recognizes the value of this approach and strives to apply it across public policies, particularly in areas that pose significant challenges such as migration and climate change. By integrating immunization programs, communicable disease control, and access to healthcare into refugee and migration policies, we protect both vulnerable populations and public health as a whole. Likewise, by safeguarding the environment, ensuring clean air, safe water, and sustainable urban spaces, we prevent chronic and vector-borne diseases and protect future generations. Similar principles are also being advanced at EU level, as reflected in initiatives such as the recently announced EU Biotech Act. Ultimately, health is everyone's business. By working together, we can protect the right to health and build a healthier, more sustainable, and more prosperous future for all.
So thank you there. Strong statement. Health is everyone's business. I think it doesn't just come down to health ministers. It will be interesting to see what happens under the presidency here. So now am I allowed to let you take your seats or to leave if you have a previous engagement? You may give warm thanks, please, to our opening speakers. Thank you for being with us. Thank you. Nice to see you. Okay, in just a moment, I'm going to leap seats. I'm allowed to have your seat now, Teresa Ribera. I'm allowed to have the more important seat. I'm shifting. Here we go. Taking all my clobber with me. There we go. All right. Okay. Come here. Oh, look. There we go. More comfortable chair. I feel very high up. Okay. So, some musical chairs. We are going to move directly into the first panel. The first panel is called Public Health Under Attack, Facing the Reality to Tackle the Root Causes of Illness. So we are going to have some scene setting. We are going to have some testimonies. We're going to start with a testimony, actually. Let me just say we were supposed to have three speakers in this opening part of this first panel. We have one because two of our speakers, the president of Lung Cancer Europe, Deborah Montague, and also Dr. Vincenzo Cordiano, who was going to talk about exposome and risks linked to chemicals. We will still cover that. Both of them are ironically unwell, so they cannot be with us. However, we do have with us the Vice President of the European Federation of Public Service Unions, so that's EPSU, Health and Safety Committee. Her name is Yolanda Gil Alonso, so if she can please join me, that would be wonderful. Thank you very much. Are you in the room? Are you? I hope you will come up. I think it's up to you. Don't you think you'd right? Yeah, come. Oh, you don't have a seat? Come, I think you should come. Don't you think? What do you think in the room? Yes. Okay. Plus, I'm rather all alone up here. So, there you go. That's you. Is there anything else you need to say about your profile I didn't say? A couple of words on what you do in your day job for these good people. Just take a moment.
Yeah, I would like to say that a part of Vice President of the Health and Social Services Committee of EPSU, I am a trade unionist of Comisiones Obreras in Spain, of the Federation of Health and Social Services in Spain at the state level. So I think I'm going to switch into Spanish, if it is okay. I feel more comfortable in that language, in my mother tongue, so I'll give you some minutes to put the heads on.
And just to say, for the benefit of everybody, you're going to read a testimony, aren't you? Which is going to be very powerful and a very good place, I think, to start our conversations.
Pues como decía,
So, as I was saying, good afternoon, everyone. And as our moderator just said, I'm going to be talking about a part that we should never forget. It's a fundamental pillar, in fact, when we're looking at health services and when we're looking at health systems in Europe as a whole. And therefore, all these points that we're addressing here, they wouldn't be possible without these people. I'm referring to health professionals. Health professionals is what I'm going to be talking about. I'm going to talk about their psychosocial risks, their daily experiences. And before going into that, I wanted to share a testimony with you, somebody who works with elderly persons in a residence for the elderly in Galicia. So I'm going to read out a testimony. I just want to make it clear that this is not an isolated case. Any day you look at any institute of this type, you'll find this kind of experience. So here comes the quote. The alarm goes off. I get out of bed. My body doesn't respond. I take at least 10 steps before I manage to walk upright. I'll have to take an anti-inflammatory straight away so that by the time I get to work, my back is no longer hurting. While I drink the first coffee of the day, I think that this week it just can't go on any longer. Tomorrow, on my day off, I'm going to go and see the doctor. I then check my weekly task rota on my phone. There have been many changes, handwritten amendments. I find it difficult to tell where I'm assigned today. Another day, they seem to have forgotten to put the heating on, for instance. All my colleagues complain about the cold. It's freezing cold. I then take the lift up to the worker station for the elderly patients, and there's a lot of commotion, and I hear someone saying, you know, we're 2 people short today, aren't we? And I realise that I'm no longer on the independent residence floor, as I'd been assigned earlier, but now on the first floor, taking care of chronic, bedridden residents and assisting nursing staff. As I approach the station, I hear someone say the resident in room 119 has had to be transferred to the hospital. She suffered the consequences of a medication error. And I think to myself, this was bound to happen. It's not the first time that I've heard them complain that nursing staff should be reinforced. And also that loading medication carts at 3 a.m., 3 in the morning, after 6 consecutive afternoon shifts without any kind of rest, and almost always doing it with just 1 person on duty is simply unmanageable. You know, that this can't be right. And when I think this, I think, well, I have to go to see the doctor another day. In the end, you know, I might end up like Pepe, I might end up having to have surgery. I then enter into the room of a resident, I start my shift, and the resident says to me, "Good morning, dear. How lovely that you're here already," she says. She can't see me, but I can see her, and her sincere smile reminds me of why it is that I keep doing this day after day. I do it for her, I do it for them.
Esto que acabo de relatar.
So that's the testimony. And like I said, it's not a specially difficult day at work or a specifically bad day at work or an isolated incident. It's basically the upshot of the way in which we organise our work. No rest. The fact that, you know, people's health, particularly those who are caring for patients, is simply disregarded and they suffer from burnout. It's a structural part of the problems that we are witnessing as professionals working in this sphere. So we talk about burnout, we talk about psychosocial stress, but we should be talking about working conditions. How are the shifts organised? How many people are actually there at their duty posts? You know, do you have actual real rest periods? Is that something that is respected? You know, health at work is something that needs to be taken into account, not disregarded. So psychosocial risks are important, and trade unions across the board in Europe have been calling this out. We have risks before us. We as professionals on a day-to-day basis have risks here. You know, we have a workload that's unsustainable, insufficient staffing. The burden is enormous, including the emotional, affective burden, which is incredible for all of us. And I think all of us are aware of this. You know, it leads to consequences. Our health deteriorates, people opt out of working in this sector, they decide to leave, and furthermore, a direct impact on the safety and on the quality of the healthcare we provide to society as a whole. That's even more serious a problem. So it's not just psychosocial issues, also ergonomics issues, other points that are not addressed properly. So we find ourselves in a society where the population is aging, and Europe simply cannot afford to go on like this. We can't make these sacrifices. You can't have the staff making silent sacrifices day in, day out. It's not sustainable. So we as unions will stand up and say, There is a European social rights pillar. There are commitments. There is a strategy for European healthcare. We need to implement these properly with sufficient funding. We need to have planning when it comes to staffing, when it comes to ratios, when it comes to taking into account psychosocial risks, and also having working conditions that are properly negotiated as part of collective bargaining agreements. We need all of this, because otherwise we will fall ill. And there is a responsibility to bear here for the whole of Europe, as I see it. It needs to be made into a priority for all of us as soon as possible. Thank you.
Thank you very much. And actually, just on a personal front, which I don't normally interject, I could not agree more, because the last 4 years, my sister and I have been through a journey with our mother with Alzheimer's in a care home, and that was good care home, a private care home. My mum died last March, and we fought for the carers alongside being a voice for my mother, because everything you say, when you started from the minute that person got up to the minute, that was a very powerful testimony. So thank you very much for that. And as you rightly said, this isn't about individuals. This is about structural working conditions, structural change, fundamental rights, European care strategy. Can we respect the European pillar of social rights? So fantastic. Very glad you came up here to speak. Warm thanks to our first speaker of the first panel. Thank you. Okay, so I'm going to read out all of your names. If you can then please come forward, if I may. We have MEP Christophe Clergeau. You can see your names here and where you are invited to place yourselves. MEP Romana Jerkovic. We also have MEP Estelle Sulemans, Professor Robert Baruki, Milka Sokolovic, please, and Kadri Sova. So if you can all please take your seats, respect your name tags, then I won't introduce you incorrectly. Nice to meet you. I saw you earlier. Thank you. Good to have you with me. Thank you so very much. As I said again, and I don't mean to say that to annoy you, because I know that you're going to do so, if you can kindly respect your speaking time, because we've gained a few minutes, I would be most grateful, so we can ensure there is energy in the room to really listen with attention all the way to the very end, because we've got a brilliant, brilliant speaker lineup. So let us come first, some responses, if you wish, to what we've heard, but I think each of you is going to talk from on a specific issue that is a priority within this position paper, a priority for the group. So if I come to MEP Clergeau first, and you're also substitute member of the Environment, Public Health and Food Safety Committee, long engaged in consumer protection and product safety. Why do I say that? Because you're going to talk about the REACH review and PFAS as well. So over to you.
Thank you very much, and it's nice to see you all. And I'm happy to be here, because this is a very, very important topic. In these times of geopolitical changes, we sometimes might forget about the everyday life problems we have, and health is one of them, and we certainly need to do more than we're doing today. And as you rightly said, I'm a long-standing member of the European Parliament, and I have been working in the past very much on chemicals. And at a certain time in the beginning of the last mandate, I was, for one day or something like that, happy, because the European Commission came up with a strategy for chemicals, and they wanted us to have a toxic-free everyday life. Since that, nothing happened. And one of the things we should have been doing, and I hope that we will be able to do, is to make a review of the REACH regulation. When it came, it was one of the first in the world. It was a good law back in 2007, but now it's outdated, and we have realized many of the issues we were facing with REACH. That is, there's a lot of problems, but let me just raise a couple of them. For instance, how do you say that? Hormone disruptors. Yeah. And that was, I was looking for endocrine disruptors. That was the word I couldn't remember. Thank you very much for helping. I think more on Greenland these days than on endocrine disruptors. However, it's not covered sufficiently. And therefore, that's one of the things we need to do. And on a daily basis, the citizens of Europe, even with our laws, they are exposed to a lot of endocrine disruptors. And they have an impact. We see more cases of cancer. We see the fact that we cannot reproduce ourselves in EU is not just because people don't want to get kids. It's also because that we are faced with problems because of endocrine disruptors. But we also have a huge problem with PFAS, the forever chemical, as we also call it. It's a group of chemicals, and once we have them, they will never go away. And they are in our environment, they are in our bodies, they are everywhere. And the reason why we have it is because we have not regulated this area in a good manner. And it's especially in daily, the products we are using at a daily level in our kitchens and everywhere when we use raincoats and things like that, we are using it. And we use it because it's easy. But the thing is that easy comes with a price, and the price is our health. And not just human health, but also animal health. The environment is suffering. So, we simply need to do something. And the European Commission is not willing to do anything because, I put it a little bit bluntly, but I think the industry is kind of saying that it's too expensive to do something. But the thing is that it is too expensive not to do anything here. And we need to revise REACH, and we need to get rid of at least PFAS in our everyday products. A lot of European countries are now looking into the pollution with PFAS, and every time they look, they find PFAS. Everywhere they look, they find PFAS. So even those countries who might not have so much, that's only because they haven't looked after it. So we need to do something, and EU needs to act, and we need to be the front runner of the world on this. We are the richest region. We need to protect our population and our environment, and we need also to put the standards up again. And when I talk about these things, I can hear that, with this geopolitical situation we're in, we're not any longer talking about EU being the front runner in the world, but I think we need to be that, and especially in these areas. So from the S&D side, I would say that a revision of the REACH is needed here and now, and it cannot wait, and we need to get rid of PFAS in our everyday life, and we need to regulate endocrine disruptors much better and much more, and we need especially to look into the cocktail effect of endocrine disruptors so we can protect ourselves. Thank you very much.
Thank you very much. And I think kind of helpful that PFAS has quite a lot of public attention. When I moderate around this topic, I am always very pleased when I find companies, and some of the bigger companies that have found substitutes. They are very committed to this. It's important to put that out there sometimes. And I would also add, when you talk about EDs, neurotoxicants, having raised the issue of Alzheimer's, which I know is very complex, still, I know we have a big opportunity there. Really need to have a look at that as well. Thank you for your passion. A million questions I'm not allowed to ask in the interest of time, so I'm going to come directly to you, if I may. Now, again, we heard from Teresa Ribera. She did talk about this cardiovascular health plan. I think you're going to touch upon this, but also more robust cancer plan. And tobacco came up earlier. I think perhaps you're going to touch on this, but let me give you the floor, please. Thank you.
Thank you, Kat. Yeah, if you want to tackle diseases that represent a huge burden for our societies, then we need to tackle the root causes of illness. And we need to be honest about where those causes lie. And this means recognizing that public health is not determined only by individual choices. We must finally stop pointing finger at individuals and acknowledge that people's choices are often shaped by the aggressive marketing strategies of powerful industries and their profit. And this is irrefutable truth. We all know that cancer and cardiovascular diseases do not emerge in the vacuum. They are shaped by environment that normalize harmful consumption. They are shaped by the markets that sell unhealthy products. They are shaped by the policy that consistently turns a blind eye at what is happening. So this is dangerous and structural imbalance between powerful industry lobbies and public health. And prevention is where this imbalance is most visible. And despite clear evidence on risk factors, prevention remains, unfortunately, fragmented, underfunded, and politically deprioritized. So we had a major opportunity with the European Beating Cancer Plan. You know that perfectly. But we failed to deliver on its full potential. Why I'm saying that? Because we were promised a revision on tobacco legislation 4 years ago, yet nothing happened. We were promised on alcohol taxation, yet nothing happened. And don't think that this pattern is accidental, because it's not. It is a consequence of the persistent and dangerous influence of commercial interest in shaping health policies. And it is precisely why public health feels under attack. So, as you know, the industry doesn't wait. They move quickly, faster than the regulation. And just look how quickly they succeeded in rebranding the novel nicotine products as a harm reduction. How? By aggressive marketing strategies, by appealing design, by aromas, by digital promotion strategies, which are particularly targeted a young person. So this is why we are calling today for the urgent revision of tobacco directive aligned with the current knowledge, with the current evidence, and with our responsibility, a huge responsibility to protect our future generations. So that is, as I said, irrefutable truth. And finally, we need to secure, as Iratxe at the beginning rightly said, we need to secure a stable and structured funding for the public health. Health spending should be ring-fenced, and if we let cancer and cardiovascular health compete with agriculture, with biotech, with bioeconomy, and so on, we will fail again. So public health is a matter of our political responsibility. And unless we are prepared to act on the commercial, environmental, and socioeconomic determinants of health, we will continue, as I said, to fail again. Thank you.
Thank you very much, and also for bringing in this issue of this structural imbalance, you know, that too much is weighted towards commercial interests. We heard a little bit from Teresa Ribeiro of where, particularly in her portfolio, she can weigh in there. I would also thank you very much for putting the word prevention out there. I know it is key to the position of the S&D group in all of this. Prevention, not treatment, not cure. Let's, you know, put the ownership right up front, and also for saying, hang on a minute, let's not just guilt trip people. It really is so much wider than the choices that you make. Thank you very much. I'm going to move directly. I'm going to jump over you momentarily and come to MEP Estelle Solemans. And you're going to come in, I think, on the mental health side. We heard very much from MEP García Pérez about that at the beginning, but if I'm right, but maybe I have it wrong in my research, you've hosted and participated in quite a few parliamentary events on mental health. I mean, this is kind of one of your babies, so to speak. So over to you.
Thank you very much. I will switch to French, if I may, because I think we have excellent interpreter, and it's quite easier for me to speak in my mother language. Donc voilà, effectivement. Donc,
So yes, indeed, mental health was something that Iratxe, our leader, underscored. Let's rewind. Let's go back to 5 years ago, the COVID pandemic, how fragile we all were. Our health systems were fragile. And this is linked to a more silent pandemic, and that's the mental health pandemic, especially among young people because of lockdown, because of what was happening during COVID. Well, these mental health issues also all of a sudden aren't as taboo as they were before, but because there have been a lot of crises and there's a lot of anxiety, mental health has deteriorated, but people are talking about it, and it has to be a priority. It has to be a health priority, as you said. It has to be okay not to be okay. So as Iratxe said, we need a real European mental health plan that focuses on prevention, that has resources, that has services provided to people. And of course, the fact that there are shortages affects the mental health sector. I come from Belgium. We don't have enough healthcare professionals, mental health care professionals, or centers to provide help to young people. I went to Bulgaria last week, and in Bulgaria, there's less than 20 child psychologists in the whole country. So, or child psychologists, psychiatrists. So we talked about psychosocial risks, and we heard what the colleague from EPSU said, and the very personal story there. And we also have psychosocial risks at work, stress, burnout, and what's happening at the workplace. That's another pandemic. And it's also a vicious cycle. So you have mental health problems, then you have a lack of staff and healthcare workers in certain areas, and then, of course, the link to women, because to recognize this at the workplace is also to say that we have these shortages in education, healthcare. So I think it's extremely important to get to grips with this. Now, the European Health and Safety at the Workplace Agency, OSHA, has launched a campaign on this, and I am responsible for an own initiative report on this because we want a directive on psychosocial risks that has a very clear definition of stress, burnout, harassment, whether we're talking about sexual harassment, other types of harassment at the workplace. We want a collective approach because we want to focus on prevention. It's not just about dealing with them once they happen. It's about preventing them because this, of course, has an impact on people's health. It has an impact on specific economic sectors as well. So we want this collective approach. We want employers to shoulder responsibility and to put in place prevention plans. Sometimes just raising awareness about how you organize work at the workplace can have an impact on mental health. So I think that this project is very important. We also want to talk about the right to disconnect and how to better reconcile work and family life, private life. Because I think that now at least this is less taboo and we must do something about it. We can't just accept it.
And again, thank you for your passion about this. Just out of interest, maybe we could just do a read of the room. For those of you in the room, raise your hand if you know 1, 2, perhaps more people who have experienced a burnout in the last few years. I have. Oh, okay. All right. So, and I just pick up on when you said that, okay, this issue of it's okay not to be okay, because there is so much public momentum, there's so much talked about online, TikTok, everywhere. The policy, the legislation needs to support, it's there, the fundament is there, and it needs to support it. So thank you very much for that. I'm now switching over to this side. We're picking up on something that was already mentioned, this ex-persona approach, because Professor Robert Barucki from the National Institute of Health and Medical Research in CERN. You're going to talk about the STOA report, the Future of Science and Technology on the exposome, which I hope you're going to briefly explain at the outset.
Yes,
yeah?
of course, yeah.
Who's all au fait with the exposome? All right, great. Over to you then.
Thank you. Thank you very much. Yeah. Well, actually, Christophe Clergeau has introduced the exposome in his speech, and he said it was a revolution, which it is. And as a French person, you know, I'm always happy and ready for another revolution, of course. Yeah. So I will be speaking on behalf of really a group of scientists all over Europe, really very passionate scientists about the exposome. And some of them have contributed to the STOA report, which was coordinated excellently by Roel Vermeulen. So what is the exposome? The exposome actually consists of all exposures you can experience during all your life, from conception to death. That's huge. I mean, of course, all exposure means chemicals like PFAS, endocrine disruptors, plastics, physical noise, light, biological like infectious and pollens, for example, behavioral, are you smoking, have you exercising, not exercising, and psychosocial, and we mentioned some of them a little bit earlier. So it's really the integration of all this, and that's really important. It is quite ambitious, certainly, but it's really important to have this integrated vision. Of course, it is the complement of the genome. I mean, we all know that the genome dictates and determines some of our health and diseases, but the exposome is really the complement. It's the other major determinant of health and disease. And actually, a lot of work has been devoted to the genome. Not enough work has been devoted to the exposome, where recent studies have indicated that, in fact, for diseases, for some diseases at least, exposome is much more important, actually, than the genome. And it's modifiable. All these factors that I cited are modifiable, therefore, you can do prevention on them. So we have, in the STOA report, we have tried to focus a little bit the exposome, and actually we have proposed to focus on so-called the 7 Cs, easy, I mean 7 Cs, like climate, chemicals, cities, child health, clinical, careers, and maybe one of them is missing, I guess. Yeah, I think, I think I mentioned citizens. I forgot citizens, which was really the most important because it's done for the citizens. And also to maybe have an initial focus on cities, because that's where like 70% of the population is going to live, and it concentrates a lot of these exposure that I have mentioned, including stress, actually. And also child health. Why child health? Of course, we are all concerned by child health, and also because all the exposures that we experience during our early life will have an impact not only on the children's health, but also on the future adults' health. So it's really critical to focus on those. And when I talk about child health, it's physical health, but also mental health, which is extremely critical at this point. Well, I think to do this, we need a very ambitious program. We have had a fantastic human genome program like 20 years ago. It led to extremely important discoveries for rare diseases, for precision medicine. It has a number of applications. Now we need to go into a major program on the exposome with very large cohorts, including citizens, including in particular vulnerable citizens, because the social, for example, status is so important for all these exposures. It will release a large number of data. We need to integrate those data. We need to interpret those data and use them. And I think Europe should be the leader. Actually, if you see what the research going on in Europe now, I mean, we are by far the largest in the world. Europe should lead this kind of program. And really, it's about prevention. It's about health, and only healthy individuals and society are, at the end of the day, competitive. And otherwise, you are not so competitive if you're not healthy enough. So, thank you.
Did you actually cringe when I pronounced it exposome? You must have just gone, oh, and then it's exposome, which was...
You can pronounce it the way you want it. If you give me the program, I'm happy with it.
I'll give you the care. But thank you, and all the more reason that approach absolutely needs to translate not just into health policies across the board, but picking up on what we've said, into all policies. It is what binds that together, what binds that important approach together. Super interesting. I can't ask any questions in the interest of time, but I would. I'd love to be in your class. That would be nice. I'm going to turn to you, please, if I may, Milka Sokolovic, who is Director General of the European Public Health Alliance. So this is all about civil society voices, patient organizations, health professionals, also disease-specific and prevention groups. I think you're going to pick up on this concern that there isn't health as a standalone priority in the work programme, you know, perhaps some worries around that and what you would hope for, why it's so important.
Wonderful. Thank you, Catherine, for the introduction. Let me just say that for someone who has started their career in genomics, the very thought of the discussion of exposome reaching the policy circles in this continent is hugely exciting. So fingers crossed, you get your money and do your research. But let me focus on what is it that I wanted to share today, which is a few views on health in all policies and how it now finds its place in the current mandate. Let me start by saying that health in all policies is no longer a contested idea, right? It is referenced, it is endorsed, it is comfortably present in strategies. But under this mandate, it is being squeezed by the center of gravity of decision-making, competitiveness framing, deregulation impulses, and budget discipline. They are presented as economic choices. But in reality, they are shaping our health. They are becoming the determinants of health in their own right. And when that happens, as Romana was saying, prevention and equity are the first to be crowded out. And there is also a structural component to it, to this pressure, which is the institutional design of this mandate. Who holds which portfolio? Who coordinates across silos? Who has the authority to convene? These are not technical details. They determine whether health can meaningfully shape transport, agriculture, energy, or social policy, or whether health is being politely consulted and then put aside. So to put it simply, institutional design is policy. My second point is simpler and more urgent, I would say. Civic space is health infrastructure. Restricting advocacy, questioning NGOs, NGO legitimacy, or shrinking the civil space are presented as neutral governance choices, and they're not. They have direct and predictable consequences. Public health depends on independent evidence, on scrutiny, and on voices that speak for communities before harm shows up in indicators. And when those voices are weakened, policy becomes less informed, less accountable, and less equitable, even when our intentions remain good. And that brings me to the EU for Health operating grants topic. The argument used to justify the suspension of operational funding for civil society is financial. And yet, in budgetary terms, they are marginal. It's around 1% of the annual EU for Health budget. And that is precisely my point. Operating grants for civil society are not a financial issue. They are a barometer of democratic health governance. They determine whether independent public interest organizations can participate consistently, not just during crises, not only through short-term projects, but as part of the governance ecosystem. And when mercury in that barometer drops, participation becomes selective, evidence becomes thinner, and the balance in policy making shifts towards those who can afford permanent presence. And I'm clearly talking about commercial interests here. So if we are serious about protecting health under this mandate and about delivering on the health in all policies, as we say we strive for, we need to look beyond headlines and ask harder questions about structure, about space, and about the signals. Because when public health is weakened in governance, It is not an abstract system that suffers. It is people, and it's always uneven. Thank you.
Thank you. Beautifully said. I pick up indeed institutional design is policy. So while health across all policies might not be contested, it is being squeezed. The importance that public health depends on evidence and scrutiny and the civil society voice. Otherwise, we merely increase inequities and inequalities. Thank you for really emphasising why health is so much the fundament of so many different areas. All right, I come right to the end to you, Kadri Suva, so the Director of Mental Health Europe. So we've heard quite a bit, and definitely I think you are very clear on why and how this is a priority for this group. So bring us a little bit more, flesh out on the emergency on mental health and perhaps among young people, but I leave the floor to you. Thank you.
Sure, thank you very much. Very happy to be here and also to have heard so much about mental health already, both from the speakers as well as in the policy recommendations of S&D, which we were very happy to read. And also happy to hear that indeed the mental health and health in more broadly in all policies has become a thing that is kind of comes naturally when we speak. But I think the next challenge is really like how to make that practical, and obviously institutional structure is a big barrier to that. But there are ways on how to ask those questions when we design different policies. And we have some ideas about mental health in particular. So if you're interested, let's meet. So yes, we are definitely facing an emergency, I would say, on mental health. And we already see that it is undermining Europe's social fabric and also economic resilience. So if we talk about competitiveness, okay, let's talk about it. And where we stand today is that we feel that mental health is still really confined into the health sector in terms of policy and topic in general. But we all know that everything that goes on around us is so important, and mental health is not just a brain issue. And living and working conditions in particular being extremely important, like we heard also from the testimony today. And when we talk about numbers, we know from the recent European Trade Union Institute study that that work-related depression costs EU more than 100 billion euros every year. And this is not costing like broader costs of anxiety and absenteeism, etc. So, it's a significant problem that we need to address urgently. And yes, also when we talk about young people in particular, the situation is very alarming. We have a really good report on mental health from Eurofound published last year. And there we see that for the age group 15 to 29-year-olds, suicide is now the leading cause of death. So it's very, very urgent. And suicide rates generally, I think across the decades, they've been going down. Unfortunately, they've been stalling now since 2017. And from 2021, 2022, we even see increases in some parts of Europe. And that's obviously linked also to what MEP Sölemans was saying about COVID, clearly. But I don't want to narrow the issue of mental health only to youth and digital environment, what we hear a lot today, and it is extremely important, don't get me wrong, personally as well as professionally. But mental health is shaped across the life course, and you know, there's people in precarious and stressful work, again, what we heard today, single parents, unemployed people, people facing also discriminations, and older adults. We need to also talk about those people. And so what is concretely needed? 3 quick recommendations from me. So I'm not going to dwell on that, but great to hear the mental health plan or strategy, whatever you want to call it, super important. It's not just a paper, it's a clear commitment, clear links to funding and laws and policies and practice. So we would really like to see that psychosocial risk prevention becomes a crucial part of employment and social policy, stronger action on work stress. this is the health in all policies, like mainstream mental health in all policy impact assessments. Ask this question, is this impacting mental health, yes or no, in a big way, small, medium way, small way, and then go from there. We want that the ESF, the ERDF, EU for Health Horizon, and also the next MFF in its new architecture, that they would fund prevention and community supports, and not just clinical treatment capacity, because this is really important. And also, finally, track and enforce progress. We have, for example, European semester process. We could have mental health indicators linked to inequalities, to working conditions, housing and education, and just track our progress from there. So we already know what works, and this is strong community-based support, school and workplace prevention, and social policies that reduce insecurities. So we are very much aligned with the ambition of S&D, and we really want to see the political priority being made, brought to life. So thank you very much.
Thank you very much. Thank you for pinpointing areas where you would like to see progress. And of course, what sprung to mind in your intervention was also this issue that came up, and it come up in other areas, is the dearth of professionals, not having enough people, not kind of keeping in tandem with what we are seeing in terms of the increase in very diverse mental health issues coming for very, very different reasons. I thank you all. I am going to conclude this panel because actually there is an MEP on the next panel who has to go at a certain time, and I want to enable us all to be able to hear him. So thank you to all of our wonderful speakers of this first panel. I appreciate you being here. All right, so just a quick read of the room. Who already is pleased that they came and has already learned something from those 6 very passionate and eloquent speakers who joined me up front? Good. All right. So we're going to switch. We're going to change in terms of the topic, and we are going to focus on what we've already heard quite a lot that came up in the opening contributions. We're going to look at equal access to healthcare in the EU, and we're asking the question, how can we guarantee fairness, solidarity, and resilience in European health systems? Now, it's a panel in 2 parts. The first homes in on access to health, and the second on inclusiveness in health. So let me first of all invite to the front, and I might switch these around, those who are going to be talking about access to health. So if I may invite to join me Agustin Reina, who is the Director General of the European Consumer Organization, BEUC. And can I also have MEP Timo Volken as well, Coordinator of the Committee on the Environment, Climate and Food Safety, can also join. And for more switching to access to health infrastructure, we have Stefania Proietti, who is President of the Umbria region, member of the PS group in the European Committee of the Region. So if you can also join us, please, and MEP and Vice President of the European Parliament, Victor Negrescu. So who have we got? We all coming?
Victor's on his way, I guess.
He's on his way, okay.
Oh, he's on his way.
All right, and can I also invite to the front, please, Maria Angeles Martin Octavio, if you might come, Director General for Primary Care of Castilla-La Mancha Health Service, and MEP Marta Temido as well, please, former Minister of Health under Prime Minister Antonio Costa. So warm welcome. Now, so he's not here yet, so I don't need to start with him, so I will keep it in the order that we have it, because we're going to start with access to medicines and more widely. So let me just see where we all are. I'm starting with you. Great, you're next. You're good. You didn't look too surprised there. All right. What are you going to talk to us about? What's your thrust, your main thrust?
Thank you, and thank you very much to the S&D group for inviting BEUC, the European Consumer Organization. So the topic of my brief intervention relates to affordability of medicines. And as you know, this House has already been quite busy with this topic, with the agreement on the EU pharmaceutical legislation, the sound very strong position on the Critical Medicines Act. So these are extremely important steps that are being made to ensure generic competition in the market, availability and supply security of medicines across Europe. However, to ensure fair medicine pricing and affordability for all the EU member states and at the European level, we need to look at deploying additional tools. And the main issue for this is that across Europe, high prices of innovative medicines continue to limit real mechanisms where there are very limited transparency for governments as well on how prices are being set, and public authorities frequently negotiate these prices alone without access to reliable information on research and developing costs. At the same time, secret price discounts and external reference pricing based on net prices lead to artificial price inflation across the different member states. And there is as well limited transparency among the member states themselves, that they could benefit greatly from greater coordination and sharing experiences about price negotiations. So what do we need? In order to address these gaps, we need better information sharing between the member states on medicine prices and the use of collaborative procurement that can increase collective bargaining power and help achieve more affordable prices, especially for high-cost medicines. We need also greater transparency from companies on research and development costs. This is something that, as you all know very well, has been very high in the agenda of the groups and others. While it is positive that the revised pharmaceutical legislation obliges companies to disclose public funding received for R&D, this is not enough. Pricing and reimbursement authorities also need information on private R&D costs to ensure that while medicine prices allow companies to recoup their investments, they do not compromise public health systems. And as well as we need to look at alternative, innovative models, we also need the EU to be more ambitious in supporting non-profit and public interest-driven research. So what can we do concretely to address this? And here we can look at three main areas. First, we need to revise the EU Transparency Directive on pricing and reimbursement. The Commission itself have carried out a study and identified clear gaps in its implementation and unmet expectations. And here we think that it will be difficult to address this gap by mere better implementation alone, especially when it comes to ensuring transparency for net prices and R&D costs, so where there is a lot of focus on simplification, competitiveness, omnibus after omnibus. Perhaps here we can really do something to help member states to have the right tools at their disposal when it comes to negotiating prices. In addition, we support the proposal put forward in the S&D paper to establish an European medicine facility with sufficient resources and capacity to steer R&D in areas of public health need, for example, for the development of medicines for children or rare diseases. And this will be complementary, obviously, to the work that ERA is already doing on medicine for cross-border health threats. And then the third point, we need to look much more at conditionalities for public funding. Now, public funding comes from taxes, comes from people's pockets. And therefore, there is a need to ensure that there is a return in this public investment that we are doing. So just to sum up, ensuring affordable access to medicine for all require bold actions on medicine prices, and health policies should reflect this. So thank you again for your attention.
Thank you. I guess you know the word that most came up was transparency. Yeah. Transparency, transparency, absolutely the red thread. More information sharing, absolutely critical, and the conditionalities there. Interesting, you called on EU support for non-profits, for those kind of areas of research. But also what stood out for me is not just transparency, it's not just within member states, it's also across, because there's that sense where, and also this kind of collective procurement. And we, of course, saw that with COVID-19. You know, it all came into the spotlight. I think it heard from Teresa Ribeiro, who said it might have opened our eyes, or was it our first or second, but it didn't open necessarily the doors always to action. Okay, so I come to the gentleman on my left, Timo Völken. You're going to pick up on this. I think perhaps look a little bit into unequal access to medicines, also talk about shortages. Over to you. Thank you.
Let's see. So first of all, I'm very happy to see so many in this room, and I think this underlines how important the issue is of good health in Europe. And indeed, for us as socialists, there's always the underlying question: does everyone in the European Union has equal access to treatments and to medicine? I think if we ask ourselves honestly, can every patient in every member state access medicines they need when they need it at a price they can afford? And if the answer is yes, I think we are done with our job. But unfortunately, the answer isn't yes. It's simply far too often still no. So there are persistent inequalities in the European Union. Patients in some member states wait years longer for innovative treatments than others. So I myself can personally count me happy as coming from Germany. Patients in Germany have access to around 90% of medicines which are authorized at EU level by EMA. But patients from other member states, from smaller member states, from Malta, from Cyprus, they don't have this access. So there is still a huge challenge. So on top of this, the COVID-19 pandemic brutally exposed not only the inequalities, but also the structural vulnerabilities in our healthcare systems. So it revealed how dependent we are on very fragile global supply chains, on geopolitical tensions, how quickly competition between member states can replace solidarity, unfortunately, in times of crisis, and how it always, in the end, it's always the patients who pay the price. So we have to overcome this, and this is why we need a strong European Union, especially in the healthcare sector. So what we need is a system built on solidarity. And recent EU initiatives, I think, moved the system in the right direction. So we agreed on the pharmaceutical package a few weeks ago, which rebalances the incentives towards public health objectives. It aims to improve availability, tackle unmet medical needs, and reduce inequalities. So in parallel, we are working on the Critical Medicines Act. In fact, we're voting on that next week in Strasbourg. This is also a direct response to the growing crisis of shortages of medicines in Europe, and especially on the cheap ones, on the generic medicines, because the supply chains for these medicines are built relying on third-party states. So we definitely need this CMA. So for a resilient union, I think, and I'm already coming to an end, we must also be prepared for everyday disruptions that will affect patients every day all over Europe. So I think what we have to do is, and we have to do right, is to anticipate shortages, to invest. We need to invest in strategic autonomy and prioritize the public interest over short-term market logic. But this requires all, especially the larger member states, to act in solidarity. So stronger EU-level coordination, data sharing, the effective use of tools, and so on, they are all good. But if we do not sign under the solidarity, we will fail. So, and then I simply come to an end. I think access to medicines is a test of our European values. So a Europe that tolerates avoidable shortages tolerates unequal access and unaffordable prices for patients cannot credibly claim to deliver health for all. And after all, what good does the best innovative medicines have if the ones that need it don't have access to it? And this is what we have to solve together.
Thank you. Thank you. And that expression there, when you say access to medicines really is a test of our European values, a test of solidarity. I also appreciate the fact that you raised this issue, fragile supply chains. We saw obviously so much of that with COVID, but the geopolitical situations which have obviously got a lot more challenging and tense since. I think it's very important that you raise it within that context, and I know that the complexity of changing geopolitical situations will come up further in the speakers as we go down the line. So thank you very much for that. And I think both of you really bringing forth this issue of fundamental rights and access to medicines is part of that. So let's have a look at access to health infrastructure. I have the great privilege of having the president of the Umbria region here today to give very much a perspective on the implementation of healthcare in Italy. And again, we heard it earlier from Teresa Ribera, putting the spotlight on the regions, on proximity, on closeness to the citizens. So the floor is yours. Thank you, Stefania.
Thank you, and good afternoon, everyone. Thank you for inviting me and the Umbria region to talk about such a so important topic as universal access to health care. Equal access, universal access to health care is not only an health issue. It is a question of cohesion, fairness and democracy, and justice. Yes, justice. It's a right of all. This is totally in line with the S&D position paper. Health must be a priority across all policies. So 3 headlines in my short speech. The first, health quality starts from territories. I come from Umbria, the region appelled as the green heart of Italy, a small, mostly rural and mountain region. So our experience shows a simple truth. When healthcare services are far away, the right to health becomes unequal. Territorial cohesion is therefore a precondition for health equity. If European health policies ignore geographies, demographics, and aging, rural and inner areas will always be left behind. The second headline, medical deserts need proximity, not emergency solutions. In Umbria, like in many European regions, we face the risk of medical deserts, shortage of general practitioners, difficulties in attracting health professionals, long distances to service. The answer cannot be temporary or emergency driving. We will invest in community health centers, strong primary care networks, integration between health and social services, and also smart use of telemedicine. Proximity is not a second-best opinion. It is a modern and effective way to guarantee access and quality of care. And the third headline, regions are key to Europe's health resilience. The pandemic clearly showed us that health system resilience is built at regional and local level. In Umbria, regional governance ensured fast coordination, continuity of care, and tailored responses. A genuine health across all policies approach must therefore strengthen regions, invest in local health infrastructures, and ensure targeted funding reaches territories. Even more, at the local level, the One Health approach is a solution. And finally, a brief link to climate, health, and environment. As rapporteur as Umbria region for the ENVI opinion on the implementation and environmental policies for prosperity and security at the Committee of Regions, I strongly believe that delaying climate and environmental action means paying a higher price later in terms of public health costs and growing health inequalities. So health is a right of all, and in approach, One Health approach is a solution. If Europe wants really health equity, it must start from its territories. Thank you for your attention.
Thank you. Super clear message underlining where the regions are, should be, can be so strong. You said regions are key to Europe's health resilience, but also there are some serious vulnerabilities there. Many. You also talked about shortage of practitioners, and I echo your words, territorial cohesion should be a precondition of health equity. We're great, we're the champions, but we need to be supported in that because there are a lot of vulnerabilities and a lot of fights to be won there. Thank you so much. I will pass on now to MEP Victor Negrescu, also within the same topic on access to health infrastructure. What can you add for us?
First of all, good afternoon, everyone. I think it's crucial for us to discuss about health today and, of course, make healthcare a priority for the European Union. And I will start my intervention from two examples. One is related to Adina. Adina was, unfortunately, in a fire that took place a couple of years ago in Romania in a club. And in order for her life to be saved, she had to be transported to Belgium, where she got the proper treatment for several months because the treatment that she needed did not exist at that time in Romania. I'm going to give you another example, the example of Maria. Maria is one of the medical assistants that volunteered at the beginning of the pandemic to go to Italy and to provide help to Italian patients affected by the COVID. These are two examples that illustrate why we need a European policy in relation to health. That actually we can do more things together, we need each other, we need solidarity, and we need, of course, to continue to invest together in trying to provide better healthcare services, but in the same time helping professionals in the field and helping patients get access to better treatment. And if we look at numbers, we see actually that more than 3% of European citizens, based on data, consider that their medical needs are not being met. And this is unequal across Europe. We have countries where the percentage goes up to 8%. 8% of a country not having their medical needs being met due to cost, due to distance, due to waiting lists. In the same time, this unmet medical needs is getting translated in problems, real problems. More than 1 million European citizens die every year while their lives could have been saved. So that means there were avoidable conditions for them to survive. And this is happening also because we are not investing equally and fairly across Europe when it comes to health services due to inequalities and due to lack of cohesion when it comes to health. Of course, this is also translated in life expectancy, and some of the numbers have been mentioned, that we have differences between countries. This doesn't mean that we are looking in a negative way to the ones that succeed in doing better. It's excellent that we have positive examples within the EU, examples for the entire world of successful medical system. But in the same time, we need to address the concern that we are having because we live in a common union, and this union, it's about the common market, also in relation to health, but it's actually a common community, a common union where everyone should get access to proper treatment. This being said, the Commissioner recently attended one of the Health Committee meetings, and we asked him whether the Commission intends to invest more in health in the next MFF. He mentioned a number. The number is around 42 billion euros, which is actually, if we compare in real terms and the impact of inflation, less than what we have right now, even though that the budget is supposed to increase, even though we have increasing needs, even though we, and I remember, and I hope you remember, we all decided to build the health union. So despite those facts, we are still looking at a smaller number than what people expect. So together with the colleagues here in the S&D group, we discussed about numbers, and we call for the doubling of the sum. The doubling actually refers to the fact that we saw figures and allocations for health across different programs, including in the national plans, where we would like a proper percentage being allocated for health infrastructure. We are looking at the numbers, we are going to register an amendment, and we are going to fight for it. So at the end, after this meeting, we have a proper outcome, and the examples of Adina and Maria will be examples that we can always refer to, but hopefully we'll have a health union for real. Thank you.
Thank you very much. Thank you for the heads up on the funding and the fight going forwards, what you're pushing for. And again, yes, for bringing examples. And did I get that right? The very compelling statistic of the deaths that should not happen, do not need to happen every year in the EU. Was it 1 million or I got, yeah. More than 1 million. And also, so in that moment, we're going to zoom out a little bit more and look at health systems, resilience and preparedness. We're going to build on what we've heard, you know, the importance of this localized care, of getting it right at regional level, the importance of cross-border cooperation. But what else is needed for health systems resilience and preparedness? I will turn first to you, please, Maria Ángeles Martín Octavio, again, Director General for Primary Care Castilla-La Mancha Health Service. Over to you. You're going to, I hope, talk about resilience and crisis preparedness, your experience.
Thank you very much. Good afternoon. Me van a permitir que hable.
If you don't mind, I'm going to speak Spanish. Is that all right? It's my mother tongue. And it's a great honor to be a part of this panel, to be at this event. And I also think it's an opportunity for us to share science, knowledge, experiences, and also an opportunity to join our efforts with this commitment in mind, our commitment being to change, if you like, our whole concept of health and to talk more broadly about health. And we have a lot of challenges, let's face it. So resilience and preparedness for crises. It's an opportunity for us to think about territories, about fairness, about sustainability, and also talking about engagement, Europe's engagement. Europe must be committed to this clearly. The countries, the regions have to be committed to this target as well. With regard to Castilla-La Mancha, we, at the regional government level, have already dedicated efforts to this. We want to look after the health of our citizens, our people, and territorial cohesion for us is a key policy if we want to be prepared. Castilla-La Mancha, we're talking about 8,000 square kilometers. It's, well, it's bigger than Belgium and Luxembourg, if you like, so it's a big territory with many, many residents, many people who live there. And what we want to do is really prepare or plan a system that is able to look after all, with different healthcare centres, with open hours, of course, with consultancies, a network of hospitals, 14 hospitals, more in fact, and also resources, trying to pool all of that to make sure that we can be close to our citizens, provide care, and to be fair across the whole territory of our region, bearing in mind that there is, you know, population dispersal and that there are rural areas with certain specific traits, specific characteristics. We have to be mindful of that. We also need to be active at the level of the community. Public health at community level is the key to resilience and to sustainability. Obviously, within this broader system, I think all of our efforts need to be present, need to be made if we want to take care of our health landscape. We all need to be included. Nobody can be left behind. More than 65% of our essential activities or key activities have to do with that service at close level, coordination, health coordination, improving our health outcomes. And for that, we need our commitment, also European commitment. We need to have coordination. We need to make sure that there's no divide, no gap in our societies and territories. Also, innovation, digital transformation, not digitalization as such, but digital transformation. That to us is key as well in terms of territorial cohesion. You know, working in networks, it's a mindset, if you like, making sure that we are able to provide telemedicine, teleconsultations, remote consultations. All of that is particularly precious for rural environments and dispersed populations. And we have projects, integrated projects with structural elements. We have certain specialities or specialisms that are part and parcel of this equation, and we need to be rolling all of this out throughout the territory. And of course, for that, we need professionals. We need professionals who are committed to the task, who are able to provide this service. We've talked a lot about professionals already, about the staff. We also need to talk about carers, I think. You know, care is essential if we want to talk about fragility, vulnerability, care, making sure that we can retain those care professionals as well. Recruiting them and retaining them is essential, and it's important for us in Castilla-La Mancha. Also research, innovation. You know, we have a research centre in Castilla-La Mancha that looks specifically at that. Also making sure that primary care can be provided across the board. New methodologies, new ways of communicating, providing information, career prospects for our staff, etc. We also need to talk about caring for those who care for us, looking after those who look after us. That's also part of our strategy. And for that, we also need a shared European strategy. It's essential for our citizens. Many of our projects, I mean, we have EU funding, which has been essential in terms of rolling out these helpful tools in our healthcare systems. But we also would like to put out an appeal to the EU. We need to have better policies for health, for preparedness. We need to make sure that we have greater cohesion. We need to make sure that public health is part of our critical European infrastructure. We also need to promote healthy aging. We need to make sure that citizens are part of the equation, on board for this exercise. That too is essential. And we need to work on health data, we need to work on interoperability, and we need to guarantee budgetary resources, investment into material, equipment, medicines, etc. And of course, staff. Professionals. We don't just need doctors, general practitioners, we need nurses, we need carers, we need physiotherapists, and so on and so forth. We need all of these different areas of expertise, because all of these staff, all of these professionals can provide the care that we all need. And if Europe is better prepared, then we will be more resilient, and we'll be more resilient in our territories, in our regions, and we'll be able to do more for people. Now, our experience in Castilla-La Mancha has shown that resilience, fairness, and all of this goes hand in hand with the efforts that we have been deploying, and I think it's a good example to follow. Thank you.
Thank you so much for highlighting there so many important aspects of where resilience and preparedness come into play, and also for raising again, you used the word innovation there. We had heard it at the beginning from Teresa Ribera. She said innovation is the key to strong health systems. You gave the example of telemedicine, which of course in the preventive approach is so critical, in the healthy aging is so critical. Again, for raising, because we heard that in the very, very first testimony, you said it's important that we care for those who care for us. And you really did explain it's a multidisciplinary, it's holistic. There are so many different practitioners, and you have particular challenges in regions and at local level in attracting and retaining some of those staff. So thank you very much for that. I'm going to move directly now to build on this to our MEP Marta Temido. As I said, former Minister of Health, very much your neck of the woods, all of this. Over to you.
Thank you so much, Katie. Well, preparedness. We must recall that instability defines the world we are living in today. Geopolitical turmoil add up to natural disaster risks, and fear reshaped what security means to Europe. But we cannot be held hostage by fear. COVID pandemic taught us a painful yet invaluable lesson. There is no security without resilient health systems. Health preparedness must be recognized as a core component of our collective defense. In today's security environment, hospitals, pharmaceutical supply chains, healthcare workers are strategic assets. And how can we better protect them? First, the Union's civil protection mechanism has proven its value, but a clear step forward is needed, extending it to formally include a European health response mechanism, legally framed. At EU level, this means permanent medical capacities, reinforced rescue stockpiles, and rapid cross-border movement of patients and of health professionals. At member states level, this means systematic stress tests to check healthcare systems' preparedness to the next crisis against common parameters and indicators. I recall that preparedness is not improvised solidarity. It is resilience prepared. Second, preparedness also means protecting people before systems are overwhelmed. That is why vaccination is one of the strongest tools we have. Yet, declining coverage, misinformation, and fragmented data are now security risks. Thus, we must clearly support an update of the European vaccination strategy aligned with European Immunization Agenda 2030. This update must deliver three things: life course approach to vaccination, better EU-level coordination and monitoring, and modern digital tools, namely EU Digital Child Vaccination Card. Finally, preparedness today must confront a new reality. Hospitals are frontline targets in hybrid warfare. A cyber attack can paralyze an emergency department as effectively as a missile attack. That is why the European Action Plan on Cybersecurity of Hospitals and Healthcare Providers must be treated as core security infrastructure. Implementation, not merely announcements, is pivotal. That requires adequate EU financial support and setup of the European Health Chief of Information Security Officers network. If hospitals fail digitally, states fail operationally. So, to conclude, preparedness must become a guiding principle across all EU action domains. Our position paper sends a clear signal. EU health systems are our first defense line, and in a poly-crisis landscape, they must be a priority. Thank you.
It is, I don't know if the word is interesting. It is so that this comment, health systems resilience and preparedness must be recognized as essential components of national defense strategies. And so interesting for you to cover preparedness and resilience. You know, it stretches from vaccination, you know, the disinformation, the fact that there is less coverage, to cybersecurity. It's vast. Thank you for that. Super interesting. And of course, in this ever daily changing geopolitical context, even more compelling that we have this discussion and we push in this way. So you've all been fantastic. I really take from you, MEP Vulcan, you said we have to act in solidarity. Even though we invest in strategic autonomy, we act in solidarity, the importance of transparency, the importance of cross-border collaboration, support to the regions, support at local level. They are right on the front line, they are right close to the citizen, and you have amply demonstrated for us all of the things we need to think about when we talk access, healthcare, infrastructure, medicines, resilience, preparedness. Who has learned something from that panel? That part of the panel. Fantastic. All right, thank you so much. Thank you for sticking to the timing. It's been great to have you with me, and I can allow you to take your seats. Thank you. I did, for those of you who are still with us online and those of you who are managing to stay in the room, I really want to bring this down just before 5 o'clock. I did say there would likely be minute creep, not because they haven't been brilliant in sticking to timing, but because, hey, there is a very big speaker lineup. But I do want your rigorous attention for this second part, which is all around inclusiveness in health. We heard about it from the opening speakers. We need to look at it in more detail. Can I invite, please, to join me here, Silvia Ganzerla, who is Policy Manager at Euro HealthNet. Can I also invite MEP Lina Galvez Munoz to come to the front? The Public Affairs Director of Eurodis, Rosa Castro. Can I invite MEP Vaitenis Andriukaitis to come? Also, the EU Policy Advisor at Global Health Advocates. His name is Antonio Gambini. I promised you we'd leave you your 3 minutes, didn't I, Antonio? Come here. And finally, also MEP Lerpayin. So, warm welcome to all of you. Hello, 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 hello. All right. It is your collective job, with your brilliance and passion, to keep these good people with you because you've got important stuff to say. This is a very key piece, all of this inclusiveness, to the S&D Group's priorities. And so for all of you online, do stay with us. This is all part of this patchwork, this puzzle that all fits together, and you can't afford not to hear this bit. So who should we start with? Silvia, so Euro HealthNet, not-for-profit partnership of public health organisations, research centres, authorities, institutes, similar bodies from across Europe promoting health, but also tackling inequalities. Perhaps some scene setting where we stand today. We're looking at women's health in particular at the outset, just to clarify for all of you where we stand, perhaps where you would like progress to be needed, and if there's any examples where you would go, oh, we should look at that, that's a good bit of best practice, that would be great.
Yes, thank you very much, and thank you for inviting Euro HealthNet at this event. We have recently produced a report on social inequalities in health, and the main conclusion is that health is not improving in Europe. There is a strong gender dimension in this evidence. Women are living longer than men, but they are living in poorer health. Women are also reporting higher unmet medical needs compared to men, with vulnerable women being even more affected. This gender gap in health has a high socioeconomic cost, and we need to address it. Better health for women brings socio-economic prosperity for all, not just for women, and a more equal and just Europe. What policy do we need for improving women's health? We need to start from a better understanding and better evidence and data on factors driving health inequalities for women. We need to set up actions to address the root causes. These driving factors are not arising only from the medical and research sectors, but also from socio-economic disparities between men and women, such as women having higher rate of precarious working conditions, poor pensions, higher pressure coming from work and care responsibilities. In Euro HealthNet, we have several examples of good practices. It was not easy to select one, but I've gone for our member, the Austrian Health Promotion Funds, because they set up a clear action plan on women's health, aligned with WHO strategy for women's health. It's about having a strong health promotion approach with a clear focus on vulnerable women and aiming to improve health literacy, reproduction health, mental health, women-related diseases such as endometriosis and breast cancer. Looking at current EU policy, we have now some very good opportunities, I want to be optimistic, to improve women's health. If we look at the European Cardiovascular Health Plan, gender is mentioned, we need to make it stronger with clear targets and to have also a focus on vulnerable women. European anti-poverty strategy is another opportunity to address socio-economic inequalities in women that are affecting their health. The MFF has been mentioned before. We are not going anywhere unless we secure funds for women's health. A final remark, a comprehensive approach on women's health is missing at the moment in Europe. And the S&D paper is calling for such a strategy, which is good. It will be important to be very ambitious and comprehensive, covering all policy and sectors, as well as having very strong approach on health promotion, starting already in school. Education is very important. Having a focus on girls, older women, mental health, return to work after long-term sickness, such as cancer, but not only, and putting health equity for women at the center, for example, by referring to Marmot Principle on Health Equity as a guiding framework. It would also be important to look at the impact of climate change on women's health, because it's also quite crucial. To conclude, EuroHealthNet is ready to continue to provide evidence, policy briefing, data to help to develop better policy on women's health. Thank you very much.
Thank you very much. And you referenced there Sir Michael Marmot, public health expert. You said he did a review, Fair Society, Healthy Lives, looking into determinants of social determinants of health. So maybe if that's not something you're familiar with, that might be a good read. Thank you very much. I heard the higher unmet medical needs, but that also brings that gender, that gap, so higher socioeconomic costs, quite apart from anything else. And I couldn't agree more. I have a 15-year-old daughter. Health promotion absolutely needs to start very robustly in schools. I will turn to you, please, MEP Lina Galvez-Munoz, because, of course, you are the chair of the Committee on Women's Rights and Gender Equality. We heard there, we mentioned in the position paper, there's this calling for a women's health strategy. From your point of view, why do we need this strategy? What do you see that really warrants this particular fight?
So thank you very much. I don't have much, no. I start again.
You don't have much voice? I
don't have much voice, probably because it is so important. It is really time, well, I will manage it like this. It is really time to speak up for women. It is clear we don't have a comprehensive approach for women's health in Europe, and I would like to make 4 points. The first one is that it is time for women's health now, and it is what we are doing at the S&Ds, the Socialist family, pushing for that. For decades, for centuries, even I would say, medicine has treated women as smaller men, as incomplete person, as a minor, as the different person, which is quite amusing because there are 10 more million women in Europe than men, and we are the different regarding still medicine. So ignoring sex-based biological differences and systematically undervaluing women's symptoms and experiences. Undervaluing at the end lives, I mean, the cardiovascular example, we all know. In 2019, Caroline Criado Pérez published her best-selling book, Invisible Women, documenting the long history of sexist bias in medical research, showing that while illness specific to men are studied, treated, those affecting women were ignored, are still very much ignored. Most probably the best example, and it is not exactly illness, but is a moment in our life all women will pass through, is menopause. That remains widely undervalued and misunderstood. Within modern medicine,
and its broader efforts on employment, you were saying, and on mental health. Indeed, apart from biological differences, the undervaluation of women is beyond specific health issues, as the one linked to the social depletion of women in our multiple roles, especially the fact that women are still main carers. It was said just before. We should not only pay attention of women as care receivers, that it is true, we need more because we live longer but in worse condition, but also as caregivers. And this is my second point. I will go faster now. That expose as we are still the main caregivers, that expose us to physical, emotional, and economic strain. Unpaid work carries long-term consequences for economic to health. So why we need to recognize the inequalities and the value of unpaid care work. This social depletion of women in our multiple roles, very much linked to the third point I would like to make. Estelle already mentioned that before, which is mental health. We are exhausted for how we need to balance multiple roles when facing inequality, caregiving responsibilities, and social stigma. Many women carry emotional burdens in silence. Our mental health as women is shaped by unique pressures, expectations, our experiences that often go unseen. Prioritizing women's mental health means creating spaces where women feel heard, supported, and free to speak openly without judgment instead of places such the digital world or social media, where misogyny is often widespread. Indeed, social media business model and algorithmic bias are worsening mental health, especially for young women. Mine is 14 years old, so I know very well, again, what we are talking about. And this is also because the increasing of misogyny in our societies as a consequence of the fourth point and last point I would like to make, which is far-right advancement. And this is something very political here, because neo-fascism or post-fascism or whatever we want to call it, I just don't care, wants control women's body and reproductive capacity. Around the world, new forms of fascism are re-emerging with a familiar goal. It happens already in the past, and it is happening right now, which is controlling women's bodies to enforce our reproductive roles and impose ways of life that undermine our freedom. Through laws, fear, and moral policy, these movements seek to dictate who can decide, who can choose, and who must obey, who can reproduce and who cannot in this world. Control over reproductive capacity has always been a tool of authoritarian power, because autonomy challenges domination, especially when we want to exercise it. Remember the Handmaid's Tale. It is very good to do it now. Defending bodily freedom is therefore not only a personal issue, not only a health issue, it is a very political issue and a fundamental struggle for human rights, dignity, and democracy, and is where we as socialist family are in. Thank you.
Thank you very much. And when you were talking there about the unique unseen expectations on women and the less unseen, but the actual explicit impacts, you talked misogyny. When my daughter at 15 is being a teen, there's a large part of me going, yes, talk back, because I know what society she is growing up in, and I know that she needs to be equipped with certain tools to meet some of these issues that are very prevalent. So thank you to both of you. More of us live long. So in terms of women, more of us in Europe live longer in worse conditions with the main carers. We are on the end of a sexist bias in research, higher rate of precarious work conditions, unique expectations, explicit impacts. For all those reasons and more, I think you have amply demonstrated why it is so important to adopt a comprehensive EU women's health strategy. So thank you very much for that. We're going to move on to now to, again, I will quote Teresa Ribera at the start. She did mention rare diseases. And one of the comments she made is that the private sector is not delivering, and that's where member states must also deliver. So let's turn our attention to that. I will turn to you, if I may, please, Rosa Castro, who is Public Affairs Director of Rare Diseases Europe. So, you know, a real civil society voice advocating for the rights, the needs, the well-being of those living with rare diseases. Bit of scene setting, what do we need? Bit of what you would hope for going forwards. Over to you, please.
Thank you so much. Good afternoon, everyone, and thank you again for the invitation for Eurordis to participate in this important debate and to say a few things about how the concept paper can add and is adding already. So let me start despite the rare label, actually what we are talking about when we talk about rare diseases is around 30 million people across Europe. So it's, you know, it's significant in terms of inclusiveness. We cannot leave all these people behind. This is also an area where high unmet health needs can meet innovation and opportunities. Let me explain a little bit why. Because, you know, these diseases are very heterogeneous. They manifest, there are many, many thousands of these different diseases. But more than 90% of these diseases are still lacking a treatment, curative or another type of treatment to offer hope to the people, you know, the patients, but also their relatives, the family, the carers of the people. On the other hand, rare diseases have been at the forefront of innovation, also in the EU. So think about many of the technologies in the biotech area, including mRNA technologies, gene therapies and vectors, and so on. And rare diseases have offered the opportunity to test many of these technologies. And these technologies then have been used for many other common diseases, for vaccines, for, you know, crucial public health tools. So there's a lot actually that the EU has done in this area. You know, many times we hear when we talk about, and the concept paper goes into this, recognizing what the EU has done so far. This is simply because no country can tackle rare diseases alone. We really need the EU. If there is an area where the EU needs more public health cooperation, is rare diseases. And there has been a lot so far. A paradigmatic example is the European Reference Networks, which are the flagship you know, cooperation, but also Erdera, the partnership in research, and many other examples. But so far, we have still a big gap. And this is another, you know, one point that I will say now, the key element that we want to welcome here in the S&D paper. There is a strong call for an EU action plan. For a framework that will bind together the existing initiatives and that will help us navigate also the opportunities that are out there, like the Biotech Act, the Life Science Strategy, many that you have been discussing in this house. So there are many reasons why we need this plan, but I know that MEP Andriukaitis will also navigate us there. I will just say that maybe why now? There is what some people will call an alignment of stars, maybe. So for many years, Eurordis and the patient community has been pushing for an EU action plan. We are not the only ones. We actually have a rare disease community that works united, really in coordination with clinicians, researchers, with policymakers. There was a high-level meeting, I will leave it to MEP Andriukaitis, and a very high political declaration calling for this plan and for many actions. We believe the time is now. We cannot afford to lose time. There is also the MFF negotiations for the next budget, and a plan cannot deliver if it doesn't have the funding to deliver. So now, just to say that in this plan, what we must not forget also is that patients should be treated as partners, not only as beneficiaries. Patients have already proved that they have a lot of expertise and that they can contribute with their expertise, with their data, with their lived experience. However, we should not take that for granted. Just a few months ago, weeks ago, there were discussions about whether the patients should remain represented and with a voting right in the European Medicines Agency committees. Fortunately, that seems to be there in the revision of the pharmaceutical legislation. We need a plan that will recognize that and that we don't have to launch a campaign again to tell why we need patients as partners. So thank you so much again. And I'm just sorry, so just to close, because it's health in all policies. We believe that the principle of health in all policies can be operationalized in the rare disease area, basically through this EU action plan, a serious framework and a strategy to guide us forward. Thank you.
Thank you. Firstly, to my shame, 30 million people. This is a very high percentage. And as you said, very heterogeneous. Good to hear that rare diseases has been at the forefront of innovation in the EU. So good to hear the EU added value there. And again, I hear that so often when I moderate at healthcare events, patients as not beneficiaries, but part of the conversation. For me, it still beggars belief, but you know, it's not my daily bread and butter, but yeah, for me, absolutely, that's a no-brainer. Thank you very much. You've already almost handed the baton over to you. You have one of the most distinguished health policy backgrounds among current MEPs, so I will pass directly to you.
Sorry, I am elected first time into European Parliament. I'm very young in the Parliament. You know, I have no experience at Parliament level, but please keep in mind that we have excellent opportunity. We use word revolution. You know, please keep in mind what coal, steel and coal agreement was really agreement with the revolution. It creates European Union. But Kohl and Decker, two patients, they created revolution and challenging European Union in the court, and we then decided to have in our hands court decision on cross-border healthcare directive. And cross-border healthcare directive destroyed single, you know, asylum mentality around all member states. And now we are speaking about possibilities to develop European Health Union. And our paper, this is why our paper is so strong. I'm very happy with my socialist family, you know. Now we have real excellent ground to build a real pan-European ecosystem for investment, research, innovations, keeping in mind European reference and so on and so on. And of course also knowing European Health Union now is in our flag. Let's socialists, let's Democrats do our best, creating European health use as an aim of European Union policies, not as an ancillary issue. And rare diseases shows how it is strong hook to create, you know, European Health Union, because no one country can solve those problems being alone. No one. We need to find not with determinants. We need to find with politicians, because you see, rare politicians who do understand problems. A lot of politicians that do not understand nothing about rare diseases. That is a problem. Not 35 million patients, but you know, stupid politicians who do not understand nothing about it. That is a problem that we need now to try to encourage you. Let's raise questions about necessity to build strong European Health Union based on those excellent approaches. Those approaches are evidence-based. They are approved at WHO level. They are approved globally. It is so important to sell health as a priority across all policies. And it is our obligation now to encourage all our member states, socialists, in every committee, raise questions about impact on our health, about assessment, about iteration, and keeping in mind concrete topic on health, on rare diseases, I can tell you, we did our practical step. We created, excellent, team. And we adopted declaration on the European innovation care ecosystem for rare and complex diseases based on 4 reports: Draghi report, Letter report, Gator report, and Minister report. A few of them are socialists. Manuel Hayter and Enrico Letta. It means that we are also leading in the field of possibilities to encourage European sovereignty, European autonomy, and possibilities to treat our patients with the best way in area of orphan drugs, rare diseases, and so on. Now it's time to act, align, and accelerate. This is a message which is now in our paper. This is philosophy. When we are using rare disease, you get a hook to act, accelerate, and align, and accelerate. It's about solidarity. Thanks, colleagues.
Thank you. First of all, I'm glad that you have a very powerful voice because you move a lot. Otherwise, the interpreters probably might not have caught all of that, but I think you did. I think you did. Secondly, here's a sneaky question. Have you ever been in a room with Donald Trump? Because I'd like you to get into a room with Donald Trump right now. That would be fabulous. I do, what I hear from you, and you said that very clearly, this creation of a European Health Unit, it's not an ancillary thing. It should be an aim. It absolutely should be an aim. Here we have it. Let's accelerate. Let's implement. I would love to stay with you. The great thing is that anyone who was ordering off Uber Eats or about to walk the dog, of course you didn't. You were there, weren't you? Because this is great about having MEP Andriukaitis right near the end of an event. Fabulous. So, follow that, Antonio Gambini, she says. But you did say their evidence-based approach, and it's been proved globally. Let's look at that. Let's put all of this into the wider global health and preparedness context. So, Global Health Advocates, founded 2001. Absolutely. Focused on political advocacy for better health policies, resources, more equitable access to healthcare, particularly for people affected for poverty-related diseases and health inequities. So give us a bit more of that global health perspective. Thank you.
Thank you so much, and thanks for the challenge of speaking now. So just let's try to, first of all, thank you for inviting me to speak at this event. So let's try to remember 2015, a different world. The world committed to protecting every person's right to good health and well-being through sustainable development goals. One of those was the goal of universal healthcare. So where are we now? In 2021, more than half of the world population had no health coverage. And alas, in most countries today, there is regression, not progress, towards that goal. Global health development assistance is in free fall. In 2021, more than 80 billions globally. Today, less than 40 billions. Of course, we think of the Trump administration, who cut radically, but also the EU and its member states have cut back. And so we are in an era of global health austerity. And this has tragic consequences. In the Lancet, the calculation was 14 million additional deaths from 25 to 2030, including 4.5 million young children below the age of 5. So this is a disaster, and it's particularly tragic because we know that international science-based medical cooperation works. It has worked for 79 million lives saved because of investments in the fight against tuberculosis. Yeah. It has worked for AIDS. The AIDS-related deaths in the same period fell by 65%. So today, of course, the EU and the world are facing many crises and challenges: climate change, inequalities, poverty. But they are also facing a resurgence of infectious disease we were on track to eradicate, such as HIV/AIDS and also polio. So the S&D position paper says health must be a priority across all policy. Very true. Health is everyone's job, and we should try to not do the same mistakes, for instance, as we did during the COVID pandemic, when some trade interests were given priority over public health objectives. So global health, why global health? Health of all people across the world is connected. Diseases, of course, do not stop at borders. And most health issues and determinants are transnational. So we need to collaborate, we need to invest. Now, the EU is currently working on the next MFF from 2028 to 2034. The Commission has proposed 200 billion euros for external action. So that is a good step. That budget must be defended, and also we must direct it to contribution to the right to universal health care for everybody in the world. And we also need to direct it towards international science-based health cooperation. So why do we need to do that? It's because it's the right thing to do, of course, but also because it's a good investment. It's a good investment for Europeans, for health security, for health preparedness, for resilience. The next MFF is also the question of research policy and budget. So I will not repeat what the excellent Mr. Reina, the president of the Bureau of European Consumers, said. Just add that for this research to be fruitful, it also has to be international and to involve low and middle income countries and ensure accessibility and affordability of the results of the publicly funded research. Thank you so much.
But I think you end on a. You were the right person to follow him. You speak with a great deal of passion. You end on a very important point, that the investment that goes into research and development, into innovation, into translating, all of these fantastic ideas to market, which in itself, as we know, is complex and has its challenges, that it ends up being of benefit. And that was those last words I really pick up on again, to my shame. Your statistics there, more than half of the world population has no health coverage. So we are in a compelling moment. You called it an era of global health austerity. There are so many arguments for getting that right. So I come to you, MEP Lerpayen. So again, to say that you were, as I understand, you served as Spain's Minister for Health, Social Policy and Equality 2010-2011, and you've worked extensively in the global health and international development domain. So a great speaker to finish this part, global health and preparedness, with. What would you add to all of that? What hasn't been said?
Thank you so much, and of course, thank you to the group and everyone who contributed to organizing this event, and also for the work on this position paper. 3 very quickly messages. First of all, for us, global health is inseparable from European security. We just have to look back at the impact of the COVID-19 to see that. In other words, global health, the global dimension of health, is a priority for this group. So the reasons are clear. It shows that no one is safe until everyone is safe. When a new variant of the virus emerged in another part of the world, they threatened Europeans. So it's a business of everybody. The second message is that we have to embrace the concept of resilience and preparedness, not only development. We live in a world of constant shocks, and sometimes development is put back by these shocks, such as COVID-19, which disrupted essential health services in many countries, as has been said before. So what is resilience when it comes to health? In my opinion, it means us and our partners, particularly in the global south, because they need to have the means to develop and produce vaccines and medicines, the health and civil infrastructure, expertise, and state capacity to distribute these medicines so that we are prepared for the next pandemic. That is why we are eager to know more about the Commission Global Health Resilience Initiative that we are asking, but we have no much information. Finally, the Global European Instrument and Global Gateway have the potential of contributing to global health resilience around the world. So we have to ensure that the Global Gateway projects and our instruments are transparent and establish clear mechanisms for monitoring and evaluating its impact. In particular, that the benefits of these projects reach the most vulnerable. And finally, for us, it's very important to be sure from the social S&D group that we are, our approach is about One Health, planetary health, and taking account the global context where we are living. Thank you so much.
Thank you very much. Not only do we have a duty in terms of solidarity, it's the right thing to do. I'm paraphrasing what you said, but it's also because the health of those across the world, we are all connected. And as I was listening to you and coming to the conclusion on this sort of resilience and preparedness, whether it's at EU level or at global level, for me, this real pillar, this prevention, is so key to that, and so important to get right. I thank all of you very, very much. I thank you for sticking to time and for being so patient to come to that very last panel.
Thank you.
You may, pleasure. You may take your seats. Thank you. We have two last speakers. Don't go away, those of you online. We're nearly there. Are you all good in the house? Conclusions and a little bit on the way forward so that we can end on a high note, all right? So it's my great pleasure to ask back to join me MEP Christophe Clergeau, and my great pleasure to invite the President of the European Committee of the Regions, Kata Tuto, who has been here throughout. And can I say, it's always nice when a closing speaker has actually been at an event from the very start, which is amazing. Thank you. All right, so, turning to you first, or turning to you first? I think I turn to you first. She's more glamorous than you. Am I allowed to say that? Only I'm allowed to say that as a female. No one else would be allowed to say that. Over to you. What do you hear? And perhaps something optimistic on the way forward.
Yes, thank you very much. Okay, why I came here. I'm president of the European Committee of the Regions. I usually talk about what are mayors, their problems, budgetary issues, and I usually talk about the new budget. But today, I'm here in a different position because I want you to know that when it comes to women's health, please count me in the team because I will come and fight with you because I was very, very lucky until this moment. Because as a woman, other women were cutting paths in front of me when it comes to sexual health, when it comes to control over reproduction, when it comes to unmedicated birth and breastfeeding. Everybody was cutting paths. Unfortunately, I am aging faster than the progress is coming. So I came to the age of perimenopause and I found all these walls and this building momentum around it. So I have this personal, political mission to help and push further these walls. So I will be here with you. Menopause will stay with me. And I will stay with you. Thank you very much for this event.
It's always the best speakers who close with a personal anecdote. No, but I'm serious. It absolutely is, because it informs how you go forward, right? It informs how passionate you are in terms of taking up the fight. So, to you, was it an event that delivered on what you hoped?
Alors, comme je suis fatigué, je vais parler en...
Since I'm tired, I'm going to speak French. Thank you to the interpreters for being here this whole afternoon, for being with us. And thank you to everyone for being here at the end of this event. This conference was extremely interesting and fruitful, and I'd like to thank all the teams involved from the bottom of my heart, my team, Helene's, the comms team, the secretariat teams. Thank you very much for all the work you've done and for organizing. And a big thank you to you, Katja. Thank you for accompanying us this whole afternoon, for listening about our battles, the battles that we want to wage. I am a regional councillor and I was a member of the Committee of the Regions, and I can assure you that you can count on us. You can count on us because cities, towns, and the regions play a very important role, and I'll talk about it. Now, I'm not going to try and sum up everything that was said because there was so much said, very interesting points made. We heard from MEPs, we heard from citizens, citizens organizations, research representatives, and our collective responsibility is to make sure that this voice is heard and that we channel it into new decisions and progress. I would like to home in on some key ideas and policy guidelines in line with what Iratxe said at the outset. Now, we have to see it whether health policies will be mainstreamed or not, because I think at the moment it's not a priority. Health isn't being mainstreamed into other policies. Lobbies are putting a lot of pressure. They're trying to throw a spanner in the works and slow down decision-making procedures. They're also trying to silence civil society. NGOs and MEPs, they want to muzzle them, and there have been so many attacks against NGOs. And if we do not hear the voice of civil society, then we cannot liven up the debate and make progress. There is a lot of political pressure from the far right here within these walls, but there's also a lot of disinformation, fake news, pressure to adopt alternative dangerous models. Look at what's happening in the United States. There were 17 compulsory vaccinations and now only 11 are. And that's just an example of the backsliding agenda when it comes to health and what is being put forward there. And now science-based decisions. The European Court has said that some pesticides and chemicals like simipetrin haven't been studied in depth. So there's a case there, and of course this is about the agencies and the Commission, and of course there is a terrible hypocrisy in the Health Committee. The EPP makes speeches, EPP members make speeches on prevention, and then it's the same ones in the Environment Committee that don't want pesticides regulation, that attack the chemicals regulation, or that even attack environment and social legislation. So there has to be political consistency. There has to be policy consistency across the board. We need a strategy. We have one. We need to brandish our position paper like Vytenis did so well, and we need a coalition. And Vytenis has been very active on Rare Diseases Coalition, and we need to pick up on that example. We need MEPs involved. And we heard 11 MEPs, Vytenis and Vigenin, who is responsible for the Competitiveness Fund representing the Health Committee. He didn't speak, but he's there. We're talking about 15 MEPs from our group. Which other political group has 15 MEPs working hard on health? No other political group. So we can make headway. We can push for this. And of course, there are others. There are people from the left, Renew, the Greens, and the EPP, of course, and we have to work together. But we also represent towns and cities, because when we talk about resilience and when we talk about public health and solidarity, a lot of the issues, all this is happening and unfolding in towns and cities. So we want to make sure that these policies are carried out with European support. And of course, we need trade unions, we need associations, we need citizen and patient voices to be heard in this public debate. If we are to build the future, and if we can bring our influence to bear on Commission proposals early on, because we know that when the lobbies get to look in pretty early on and then it gets to our office, then it's almost too late. It's just damage control. So we need to make sure that the European Commission, or that we impose on the European Commission, a different political agenda. Now, what do we need? We don't have enough tools, we don't have an agenda, and we don't have the budget we need. So when it comes to tools, we don't have data, we don't have research, we don't have enough monitoring and surveillance. And yes, we need a European health data space linked up to environmental data. We need research into genomics and the exposome. We need to turn the priority on its head. We need to have scientific targets and objectives that feed into prevention policies. And we need to set up a European Health Agency. Yes, it's only in the EU that we don't have a cross-border monitoring of the public health situation of our citizens. This is an absurd situation. And of course, it is hampering the implementation of data and the realities out there. And I think that this is the first pillar we need to focus on. Then we need an agenda. Yes, we have a cancer plan. We have the new cardiovascular plan, which is new, biotech, the Critical Medicines Act, which we've been wrapping up. But 2026 is a big black hole. Global Health Response Initiative is the only initiative for 2026. But I hope that this will help us address global health issues, but no one knows what's in there. And if we all put pressure on the European, or rather because we all put pressure on the European Commission, it said that it's going to overhaul the tobacco legislation in 2026. But we're going to have to pile on even more pressure to make sure it does happen in 2026. But what about 2027 and 2028? You gave us a huge list of, a huge to-do list. Women's health, mental health, rare diseases, health preparedness, the UCPM on civil protection. We've got legislation there, but we've got to go further when it comes to resilience and the capacity of our societies to deal with these crises, hospital capacity, staff, healthcare staff, that is, professionals. We need to make sure that we're there and that we can do what we have to do. And then how are we going to finance health? If we want to have security, then we need to look at that. The overhaul of REACH, we've been waiting this for a while. The USAFIC, the chemicals lobby, wants to stop this in its tracks. And then the prevention pillar, we keep getting back to that because it's vital. Of course, we've got the member states, but we've got to make sure that everything dovetails and that we have a holistic approach, a systemic approach, and a coordinated approach to prevention. We heard about the exposome, we've heard about what people are experiencing on the ground. And then, of course, we need money, we need a budget. We need a new definition for what EU for health should be, specific research policies, and then research and prevention in the health sector and across the board in the EU. I'm afraid we've got our work cut out for us. The commissioners said that there would be 42.6 billion euro. That's what's been allocated. It seems wonderful, but we've also done our homework. The EPRS, the European Parliament Research Service, said that what has been spent so far is 28 billion euro, and you've got to add the 6 billion for HERA, the health preparedness. So 34 billion as a reference point for 2021. If you add inflation, that gives you 41 billion. But the MFF has increased greatly. So Olivier Varhelyi's suggestion is actually a budget cut for health if you look at the new MFF 2028 to 2034. So what Victor Negrescu says is key. We need to ask for double what he's putting forward, but I'm not just, I'm saying an increase, a twofold increase, but not just for fun, but because we've broken this down policy by policy, fund by fund, on the basis of what you've given us. And we're doing the maths, and this is the figure that we're getting. This is the absolute minimum, if you like. So I don't want to drag this out any further. We need to build these coalitions. We need to change the balance of power here. We need to look at towns, cities, the environment, how this all dovetails. We need a better diagnosis of the situation. We need to listen to citizens, civil society, local representatives. We need a proper budget, and it's only then that we're going to become credible. And then, just like in rugby, we're going to have to convert, and we need to really make sure that we deliver. Now, this is a good starting point. A lot remains to be done, but we need to win this battle together. Mr. Clergeau kindly thanks the interpreters. Thank you for being with us this afternoon, and thank you for making this so interesting and in many languages. Thank you.
Thank you. Thank you so very much. It's been just a couple of words and we're done. A great privilege for me to be here. I learned a lot. Absolutely the event, not that it was making the case for anything because we know this, but for those who perhaps don't know that this is clearly not just a sectoral concern. Absolutely, health has to be shaped by policies across the board. And also this comment, only healthy societies can be competitive. If we're coming back to that word, competitive, but health is entwined with economic stability, social cohesion and security. And we looked at all of that. Thank you. So may I say, huge thanks to all our fabulous speakers who condense but a fraction of their brilliance into 3 minutes. So thank you so much. Of course, to the S&D group for organising and hosting the event. I will do a special shout out to Hélène and Ostea. You have been fabulous. Hélène, I think you had about 3 nanoseconds to pull this all together with Ostea's help. So really well done. Huge thanks to the interpreters. We were nearly just under 2 hours, 40 minutes there. So really huge thanks and really to our audience, online and on site. It's a long time to go without water or food. But now you have your non-alcoholic cocktails, so do engage speakers in conversation. I wish you so much luck in your future endeavours. Thank you very much for having me. Thank you.